This is the Barbell Therapy and Performance Podcast, where traditional healthcare is redefined to help listeners achieve peak performance, accelerate recovery, and elevate overall health. Hosted by Dr. Brett Scott, a doctor of physical therapy and national strength coach, this podcast explores the worlds of fitness, alternative medicine, and holistic health. Each episode uncovers innovative strategies and practical solutions for those seeking to enhance their quality of life when conventional methods fall short. It is our firm belief that every living thing has potential, and it is our mission to help you find that potential.
Hook 'em.
There it is.
Can you do that again for a pre-check?
This is here doing a pre-check of the Dodge 1500 Longhorn Edition. Welcome to America's finest quality truck, made here in America, American quality, American steel. Listen here, this ain't no Ford, this ain't no GM, this is a Dodge 1500. Hook 'em, Longhorn Edition, baby. Grass-fed.
So I actually got that.
That's awesome.
That should probably be the intro.
That's the intro.
Are we ready to go?
That's the intro.
I think we're ready.
We're ready.
All right, welcome to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. And that you just heard is Dr. Tom Sheriff. And also with us in studio today is Connor Bombaci, or Dr. Connor Bombaci. So for those of you that know us well, Tom is leaving us to take a career in the military. So we've been talking about doing a podcast for, I don't know, a year now. And we waited till the last week to get it done, but here we are. So we have plenty of things to talk about here. By the way, since we just started pretty quick and without any notice, because Tom was just on a roll there. Feel free to swear on the podcast. We can do that. Okay. This is not PG. All right. We'll get into some stuff. So, where do we want to start? We mentioned some things. We were talking earlier about one of the most frequent questions we typically get is, what are our thoughts about Squat University? So does anyone want to start with that?
I'll start that off. I'd say about 15% of it is really helpful for a large amount of the population, but I do feel that a lot of it is not garbage, but kind of unapplicable or reaching for clicks. Feel free to expand upon that.
Yeah, I guess I'll simplify it too in saying when you're really good at thumbnails of big booty Instagram models and using those as your intro, you could draw a lot of attention. And then using really simplified terms are helpful for the general population, but it almost simplifies the techniques that should be used in physical therapy for a lot of patients. And you can go down this rabbit hole being like, oh, I need to do this, this, this. And then that's not individualized to you. So for maybe 20 to 30%, I'd say is good content, maybe a little higher than what Connor was saying. But for the majority, it's like, this is kind of just clickbait, honestly.
Yeah, I think some of the stuff he does is adequately knowledgeable, and he does some stuff that I've been like, oh, like, this is kind of cool. Like, I never looked at it this way or never thought of it that way. Or maybe there is some quick little hack to, that can help someone with an exercise prescription problem or something. But I think the problems I have with it are, it's very dogmatic, I would say, in that sometimes he's promoting just like, you should lift heavy weight and like, look at this grandma lifting weight, or look at this big booty chick lifting weight. And they're all like, lately, even like people are commenting on his thing lately of like, the dude's just kind of like a thought chaser with whoever he has on there, which like good for him for building a social media that way. And he's probably making way more money than any three of us combined with
He's crushing it out there.
Following, right? So good for him in that sense. But there's just some things he say that I can't get behind at all. And it's just like that makes me not want to promote it at all, because sometimes it's like, lift heavy, you need to lift heavy, but then it's also, then at the other end of the spectrum, he says everything against that is like, you need perfect form, everything has to be a certain way. And so he posted one the other day of a weightlifter, and I actually commented on it, just saying that I completely disagree with him. And I had like 200 likes to my comment, and it was centered around an Olympic weightlifter. And I think it's just something he doesn't understand, and it's kind of stepping out of his wheelhouse maybe a little bit. But he was just saying that he was like, she bailed on the first rep because she felt her knee and her foot cave in. And I was like, no, she was probably just trying to exhibit power or speed to get under the bar on the first rep without wasting her energy to finish on her second with the full squat on the way up. And it's just like, as someone that does weightlifting competitively, you're not thinking about what your foot position is in a clean. And it doesn't make sense to. And so for him to sit there and say that, it's like, cool, Aaron, you maybe clean 135 pounds or 65 kilos, whatever. Great, but we can't say everything's about position, and that your movement has to be perfect, or just having this. He goes back and forth between lift heavy and do these things and look at all these awesome people doing things, but then also, oh, no, it needs to be done this way, and if it's not done this way, it's wrong. Then you're gonna get hurt. And then, not to mention his whole bias of he's selling shoes and footwear now. Granted, I love those tier shoes. I do. They're the best weightlifting shoes I've had. So shout out to them, but I know they have his stamp and maybe co-marketing, whatever. But yeah, it is a wider toe box. Yeah, my feet feel more comfortable in it, but I don't know if that change of positioning in my big toe is really adding that many kilos to my lifts, or that I would get hurt in a different shoe because the toe box isn't as wide.
Yeah, I think it breaks down to like what happens in the social media space is the simplification of otherwise complex topics that people in the field can talk about ad nauseum and go into the weeds on, but they only have 30 seconds to convey it to an audience. So once you get more and more popular and you start introducing these kind of variables to get clicks and add more people into it, it's kind of just over time, just more and more dumbed down, more simplified. We can dive into, like he said, this doesn't really make sense in the sport. Like you said, relying on the biomechanics versus just like being an athlete and moving athletically and not thinking about your body position all the time. But that's kind of his approach, and it's been successful for him. And I think that he still provides good information to people, but to what extent is it really helpful from a PT standpoint when we have to then educate people on the nuance of what he's talking about?
Yeah, I was going to say the same thing in terms of he does a great job starting the conversation and nuance is kind of left out the window. But there's a lot of clients that will come up to us and ask, oh, what do you think of this? And if it's one of those great contents, I'm like, hey, more than happy to say when he puts out good content. But then we have to kind of correct or keep it within the directional beacons when he puts out something that might be misleading towards some of our clients, I would say.
Yeah, and I'd say that's the biggest issue with not just him, but others too, of going down the biomechanical rabbit hole of, and we see this a lot, like when we have trainers and stuff that are into this field. So sorry for those of you that are strength coaches or personal trainers or what have you. But a lot of people that have fallen in these traps of like the Kelly Starrett, the Squat University, some other people where it's like, this is the most optimal way to move, and if you don't move this way, it's wrong, is a place where you're gonna feel pain. And like so many people come in and it's like, the only reason I see that you're in pain is because you're overthinking every little bit of movement. Like, we shouldn't have to think about our movement so much. Like, I had an engineer one time, and granted, he's an engineer, so like someone that's very analytical as a personality, but he had all this pain, and he had read Kelly Starrett's book actually, and was going on and on about, well, I realized like my glute's not firing here, and my knee doesn't track out here, and my patella is here, and I probably don't have good big toe mobility, this and that. And try to talk him out of that more and more. And it's like, and then he was asking about riding his bike. He's like, well, should I make sure when I'm riding my bike that my knee's like out over the lateral aspect of my foot? I was like, no, dude, just ride your bike. Like, you should just be worried about not falling. And he was a hockey player too. And I was like, are you thinking of where your knee tracks when you're playing hockey? Or are you trying to get a puck into a net? And it's like, I'm trying to put the puck in. And it's like, okay, well then why in anything outside of sport when it comes to training are we thinking so much about movement in this perspective that everything happens in a vacuum and that you're going to hurt yourself if you move any bit but perfect?
Yeah, it's paralysis by analysis, essentially. Like, if you spend that much time worrying about how your foot tracks over your knee when you're biking or playing hockey or hiking, for example, something I'm very familiar with in New Hampshire, it really doesn't break down to that when you're actually doing the activity. I'm not thinking about my knees when I'm hiking, unless I'm really just sore and I'm feeling it. But I'm not thinking about how my knees are moving. I'm thinking about that acute pain that I'm feeling at that time in my knees. I think Craig Liebenson says this really well. For anyone who doesn't know who he is, he's a chiropractor turned more exercise based. He still does chiropractic manipulations and adjustments, but he spends more time with exercise, thinking more about the health span and the lifespan as this continuity. And variability of motion is kind of the big thing that he preaches. And I think that's kind of how I've been crafting physical therapy for the past years. I don't really care how you move. To a certain extent, I do. But within the confines of this is okay, not to the extremes, I'm going to be fine with someone moving a little bit off. Because I know as long as they're comfortable moving that way, they're going to move that way when I'm not watching them. And I want to be able to master that movement as well as the various other variations of that movement. Say squatting where there's a little bit of knee valgus. I don't really care. They're probably going to do that without my supervision. I don't need to be rigid on the form, for example.
Another thing is PTs is, does it pass the eyeball test? And I don't just mean our eyeball test, but also if they're doing a movement and you're watching them, do they wince in pain or is it totally fine? And they're almost looking to you for like confirmation, almost like a child that fell and they're looking to the parent like, am I okay? And if you're the PT, it's like, excuse me. If you're the PT, it's like, no, that movement in that plane is totally fine. Like, you're okay. As long as you're not experiencing pain, like, I'm happy.
Yeah, the other thing too, especially when it comes to sports or lifting and training and competing, is that it doesn't happen in a vacuum. So like, I almost want to prepare people for the moments when you are weak, when you are fatigued, that we're exposing you to load. So like, let's have you do some training when you're actually fatigued so that you're exposed to these micro doses of, you know, in proper position, and in quotations here, of we want you and we want your body to know how to respond in these different positions to different loads. And so that when you do get here at a bad time, you can withstand it and you're not going to get hurt from it. Versus like if you only deadlift with a straight back all the time, right? And straight is relative because we don't even really know what straight is by the data. But if we do that all the time, and then I go into a competition, so say I'm training 80% all the time, like the Shiko powerlifting method is like 80-85% all the time. Now I go into a competition and I haven't exposed myself to a position where maybe I haven't trained heavy enough and all of a sudden my back rounds. Well, now I might experience some type of pain or injury because I'm hitting a weight I've never hit before, my back's never rounded. Versus if you train through some fatigue and we had the spine round out a little bit, we might be fine.
Yeah, just exposure to loads in different positions. It's as simple as that. Like, at the end of the day, a lot of these concepts, when you're in the field for a while, quite boil down to the simplest thing. And it's taken us a lot of research and a lot of understanding to get to this place. But now we look at it and be like, yeah, no, duh, like, work hard in the gym, train hard. But there's tens and hundreds of thousands of people involved with this over time to just get to that basic statement of like, train hard, load things, work through variability of motion. And now we sit here and be like, yeah, that's what we should do. Make it seem simple.
Yeah, it really comes down to like, let's get away from all the social media bullshit and realize that not getting hurt or rehabbing an injury and getting better really just comes down to push your load slowly each week by like 5 to 10% tops, and you will likely get better. Granted, like if you throw some loaded movements in there that are small things like what we would call like corrective exercise, that can help too, for sure. But really you could do all the corrective exercise in the world. And if you're not respecting the fact that you need to slowly ramp up your training through like week by week through a macro cycle or a mesocycle, then yeah, you're probably going to get hurt in the end. And also just respecting basic recovery. So like when I pulled my adductor, tore it, it was because, well, probably partially because I was feeling good that day too. But then looking back, I was like, yeah, you know what? I was out late the night before. I had a few drinks the night before. I probably didn't get a great night's sleep. And I had been run ragged from this place of work for the week leading up to it. It's like, yeah, so shit happens. Maybe I shouldn't have gone to the weight I did when I did because of like those other factors. And maybe I would have avoided injury, but Also, part of sports and performance is when you're messing with or trying to figure out what your body's max capability is, well, injury can be on the other side of that once you find out that your body can't do that much weight or that much load.
Yeah, I think the overarching theme here with going back to Squat U is that, I mean, there is some good stuff in there. There are things that you can benefit from watching his page. At the end of the day, he's so large at this point that it's more of an operation to make money than it is an actual way to get quality information. You're better off just seeking a professional in the athletics that you want to be involved with.
To reiterate, Instagram is for entertainment, not for educational purposes.
Well, let's back up there. I would disagree with you on that, in that I think we all have like educational components. Like we have a group chat of like clinical education stuff. So you can get educated. However, it shouldn't be where you think you're getting a degree from. Right? Yes, there's snippets here and there, but you're not getting the full picture of everything that goes into this. And like
Exactly.
people come in all the time, or like friends of mine will be out or whatever, and it's like, oh, yeah, can you like tell me what's wrong with my elbow? It's like, no, I can't. I do an hour eval to figure this out. We're at a bar. I can't figure this out right now. I was like, maybe it's this, maybe it's that. But like, if you really want to know, that's going to take me, who's been doing this for 7 years and took 7 years to train before that. So I've been at this for 14 years now. I can't just sit here and figure this out in 5 seconds. So the random guy on the internet can't tell you exactly what's wrong with you in a 30-second video clip either. And I think people just need to hear that more. And then who are other people we wanted to talk about with social media?
Mr. Joel Seedman.
That's right, Tom.
Yeah.
What do we have to say about him?
I have nothing good to say about him.
Let's go on.
He has purposely said he does some of the things that he does for clicks. And he's working with high-level athletes and essentially selling them products to say, like, this is going to make you more athletic. Nothing that he does is going to make you more athletic because it doesn't train what you're doing in sport or the rate at which your muscles are firing to produce power, speed, or velocity. All he's doing in most of his videos is stability, motor control training on various stability types of devices, be it an earthquake bar, be it half reps, which have their place for power development, and you'll see that a lot in strength and conditioning rooms. But the way he's utilizing these things together in conjunction don't actually end up benefiting you the way you think they would.
Yeah, I mean, I listened to the Mike Israetel podcast. I forget who else. I think they had like a mediator on there. And Joel literally said on there, I put things up for clickbait. Like I make these exercises because they're like eye-catching. And I think he even said like he will say absurd things just for the sake of likes and comments, even though he's a doctor that's like taken an oath to do no harm. Well, he's a doctor of exercise.
PhD.
Yeah, he's a PhD of exercise physiology. But either way, like when you go that far to study something, like you should take your work serious enough that like it, especially when you have that following, I think we need to realize that you can affect people's lives. And it's like, you shouldn't be doing it just for your own greater benefit of clicks and likes and buy my program or read the research, which none of his research I think was peer reviewed. He talks about this book he wrote or his thesis, and there's not much actually that's in there that's evidence-based.
If a PhD is trying to sell me things, I'm probably not going to buy from them because they're going to have a bias towards their research. Any researcher does, but it's more evident when someone's trying to sell you something too. So like the social media PhDs, some of it is good. Like I even disagree with Mike Israetel sometimes, although our Renaissance periodization is a good system. He'll say outlandish things again to get clicks. It's the nature of the landscape. It's a money-making operation. It's designed to get you to draw your attention in. So if some of the stuff is good, great, but it's hard to differentiate from that if you're not in the field that we're in with the knowledge that we have.
I think a lot of the most effective things for both PT and exercise are incredibly simple And those things aren't usually the things that will get you likes, clicks, shares, stuff like that. So why would they share something that's so simple and yet evidence-based? It's not going to get them clicks. So I understand why they do it, especially from a business standpoint. And again, kudos to them. They do have amazing brands that they built, but simple doesn't sell.
Yeah, simple doesn't sell, unfortunately. But Seedman just continues to put up this shit that's like, it's not even real. Like, you're going to get hurt if you train past 90 degrees is asinine. Look at every weightlifter out there. If anything, I'm going to argue the opposite of, let's look at how let's look at injuries and let's look at mobility. Right? If we're lacking mobility sometimes, not always, but that can lead to injury or some type of movement dysfunction that later on turns into some type of overtraining syndrome. So looking at that, and when we look at how people train bodybuilding, right? A lot of people, like, they train through like too much fatigue most of the time. They're doing a ton of volume also, but a lot of it becomes like this half rep stuff because they're already sore, they're already beat up. They're moving in one plane. Like, they're not really looking to have more mobility anyways. So we see these partial rep things, and then like these guys come in and their pecs and shoulders are all jacked up and they have no rotation. They can't open up. And then you look at Olympic weightlifters who also train very heavy, but in a very different realm of, we are constantly trying to establish full range of motion every day. And you're squatting ass to grass. You're squatting way beyond parallel. And no one in that sport really gets hurt all that much besides these little like overtraining things here and there, which can usually be cleared up with a reduction in volume, a change in your training mode for a little bit. Like if a squat's bothering you, all right, we'll split squat or deadlift or something instead, and it can go away. So I don't understand why he's out there still saying like 90 degrees is the way things need to be done because, yeah, again, looking at weightlifting, everything is pretty much an extreme end range of motion, and no one's getting hurt really that bad. Like freak things happen, of course, but I've almost seen, like, I've gotten really bad quad tendonitis from training to 90 degrees when like my hip hurt actually, because I was trying to avoid depth. So move a tendon in a joint through its full range of motion and train it, like, you'll probably be better, orthopedically speaking.
I do believe, and I don't have the exact statistics on it, but Olympic weightlifters have one of the lowest incidence rates of injuries out of any sport.
We do.
Part of that could be because it's a non-contact sport, which obviously puts it at a lower risk.
Yep.
But I believe it's one of the lowest. So it just gives more credence to like, okay, who are these people that are in this population who are working on their full range of motion? And that might be a correlation like, hey, if you access your full range, you're less likely to get injured in this activity. So yeah, I agree. Like that 90-degree terms, just like, again, it's clickbait. It's something for someone to argue about, like we're talking about now, and generate some either negative or positive press. It's the whole system. So don't hate the player, hate the game in this case. But I also hate Joel Seedman. So
the other thing too is in terms of ACL thickness, I'm pretty sure weightlifters have some of the thickest ACLs as well.
Correct.
So if you're talking about,
I have a thick ACL, Connor.
That's a nice flex. I was more thinking along the terms of how a lot of days now the female athlete triad and ACLs is such a big deal. So if I was a college strength coach and you weren't starting to expose these kids to deeper ranges of motion of knee flexion under load, it's time to start kind of exposing your thought process to that and start considering that to be a new training modality for you.
Yeah, well, the ACL thing is actually interesting there. So I used to think it was because of deep squats that they had that was building the ACL, but actually the ACL goes on slack, so it's at like 25 degrees. So if you think of all the plyometrics of like the power positions, the hang positions, the catching above parallel.
All the positions that you would put a college athlete in.
Yeah, that's what's building the ACL up, which is like above 90 degrees, so great. But in the same breath, like if you fall and your knee fully flexes or like you end up ass to grass, you should be training those positions still in some way. So either way, we shouldn't just be saying this always and never of training, because there's so many fucking different ways to skin a cat here, and have good training. But this, yeah, just go to 90, do this crazy exercise, look at these athletes. And I'm really curious how it works too with his athletes of like how he gets these people and how like the professional organizations don't know this guy's a doofus yet.
It's a really good question. I don't think a lot of athletes, even though they're athletic, are informed on the principles of strength and conditioning. They're essentially going to someone to help them. They don't really know better or for worse for the most time, or for the most part. Like how much does a freshman to senior in college understand about strength and conditioning principles, other than they're just going to the gym, they have a program and they're working through that.
Yeah, but he has like pro athletes in there too. Like how does the strength and conditioning staff at this pro team not step in and say, you need to see someone else? Besides the fact that like this guy's paying cash to see him. Cool. Anthony actually reached out before and he charges $300 an hour for personal training. I mean, good for him, but
he's got that PhD, trust him.
He's got that PhD. Yeah. And, who else do we want to go after on social media here? Who else do we want to talk about? We talked a little bit. We've talked before about knees over toes. That was another one. I don't hate his content. I think the thing with that is it's for some people, but again, if you're someone out there that's trying to find the right fix for you, try it. Maybe it will work, but also if it's making you worse, just because some guy on the internet said it, that you should put your knee over your toe, maybe you shouldn't right now. And I think he says that too and we did a video a while ago and we got, it got pretty popular pretty quick. And people had some things to say, and it's like, again, this is social media. Like we are still trying to build the brand too. And yeah, you can't get everything out in a 30-second clip of all the nuances to something. But my thing was just, don't just do something because some guy on the internet said this is good for you. Granted, the goal is for all of us to be able to bring our knees over our toes, but maybe at this point in time, you can't. Like if you have a meniscus injury, an ACL tear, arthritis, like it depends where you're at and where you're trying to get to. Like maybe this is something for you, maybe it's not, or maybe there's some other intervention you need. So it's just, with him, it's more of, he just created this kind of drastic or extremist approach, which isn't bad. And I think, yeah, that's the goal right there for athletes to be able to get into deep knee flexion based positions and bring your knees over your toes and have good ankle mobility for athletic performance, strength, whatever. But it's not going to be for everyone. Not everyone's there. Not everyone's ready for that. And it's, how do you get there? And I think the other thing too is like he has courses and stuff he teaches now, or you can even get for your own learning. But again, people aren't buying that stuff. They're just seeing a 30-second clip and putting what things they think are together into a space and making this thing up. And then I don't know how many people I've had that had knee injuries, tried knees over toes and then got worse because it was the wrong thing for them.
Partially, I don't necessarily agree fully with what you said in terms of knees over toe, because he has regressions programmed into their program. So you don't have to be like in these certain positions. They can back off.
Yeah.
And they say don't train through pain is one of their philosophies, which I necessarily agree with.
Yeah.
But I think the bigger thing for him is like, he shows all these athletic things that he's been able to do since he's been doing this program. None of the things that he does in his program build these athletic things that he shows, like dunking. He doesn't do any kind of plyometric training. He doesn't do any kind of jump training. He just does the reverse sled drag. He does his knees over toes split squats. He activates full range, and I think that's good. Like, get to your range that's available with little to no pain. Like, that's a good statement to make. But it's the jump and leap that you make. And I think you'll see these more professional strength coaches have a lot of beef with him because he makes that jump. And they're like, no, you can't make that jump. That's not where that goes. It's not how you train for this.
Yeah. Well, and what I was saying earlier, like I agree with what you're saying in that I think it's not on him, but it's the people that are taking the information.
Sure.
He does have regressions and everything. I know that. But not everyone's seeing that. It's just like, oh,
Yeah.
I saw this quick video of this dude like trying to scrape his knee against the concrete wall 5 feet in front of him. So let me try that too, because he said it would work. Mm-hmm. And his whole thing is get your knee over your toe.
Yeah. And you can't control for those people, like they are going to do it. And that's like the aspect of social media. Like you're only exposed to that program for as many 30-second videos that you watch. And maybe that's not enough information. mean, he does have programs and people have bought into that and have had success. And that's across all these guys. Like, people have had success with their programs. There's also a lot of people who haven't had success with these programs. So you take it with a grain of salt. Like, yes, there are going to be people who don't regress. They go right into it. That's the only information they were exposed to, and they get injured. And then you're going to have the people that buy into the program. They follow the steps that actually kind of make some sense. But for me, my biggest issue is that big leap that he makes. Like, you can be athletic. It's like, well, most athletes aren't asked to grass. There's very few athletes that need to be asked to grass. Olympic weightlifters are one, for example. But like, I'm not going to have a sprinter that doesn't really need to be generating force down there.
No.
Generating force down there. Maybe their range and their mobility should be appropriate for a normal adult or even a youth athlete. But I'm not going to try to make them strong in that lower position when the strength actually comes from those reduced joint angles in the power positions.
I think it's a nice reminder for us too, though, as clinicians. Like, our clients see this stuff and they think it is the word of God, and they're going to bring it to our attention. And we need to do our absolute best to educate them on which ones are the gems of his post. That's like, oh snap, that's real. Like, take that to the bank. And then there's sometimes when he posts stuff and I'm like, oh God, please don't try that. Like, if you're just coming off an acute flare up, like, please God, don't try that. Like, you're just going to put gasoline on the fire.
Mm-hmm. Yeah. And, yeah, I didn't even really realize I'm not super familiar with all of his stuff, but I didn't know his program didn't include like plyometrics or anything.
At least to my knowledge, he may have included some stuff, but I think a lot of the videos he uses is him dunking and then going into full ass to grass squat following and be like, see, this is what you could do.
Yeah. And the other thing too is like with basketball players too, we typically, like, we're not having them squat anywhere below parallel.
Your whole sport is plyometrics.
Your whole sport is plyometrics. And like, yes, you need strength training, but like those guys typically, especially like pros, they're 6'7" or whatever. They should be deadlifting off blocks that are elevated. They should be squatting. Most of them probably can't even get to parallels, and it's not worth the risk. So keep it above there. So it's like, yeah, this is a
Square peg, round hole.
Yeah, square peg, round hole. So it's a tough reach to make with a claim that it's like, okay. Like, I get he's trying to do some good. I think there's some merit to what he's doing as far as improving some joint health and things, because we should move our joints as much as we can every day. But again, we shouldn't be forcing it. And if we feel like something's off, trust your gut on it.
I think the big question too is like, what made your athlete an athlete? Was it the strength and conditioning room, or was it their sport specific training that they had all the way from youth and their innate ability to be an athlete?
I was gonna say, it's like, how much of it is just like, can he just dunk because he can dunk? Or, yeah, has he always had that ability? Or is it really the training he's done that brought it there? Because
exactly.
I tell people all the time too, they're like, well, why is so-and-so good? I'm like, they're wired different. Like, they're neurologically just strong. Like, you don't get to the top with just hard work. Granted, there's a shit ton of dedication, consistency, motivation, mindset, athletic ability, recovery. Like, all those things have to fall in line to make a great athlete. But some people just genetically are strong or powerful or explosive or have really good endurance. And not everyone does. So it's seeing that in people too and realizing like, oh, maybe it's not the program that's going to get me here. It's just, that's the hard pill to swallow for some people. Like, yeah, you're just not genetically that gifted, unfortunately, to be at the top.
Just reach whatever potential you have and train to your enjoyment. If you have that potential to go further, shoot for it. That hard work's going to take you there. But it's that kind of prerequisite of like, do you have the genetics? Do you have the neural coding? Do you have the right muscle fiber distribution for that sport? Are you athletically gifted in that sport as well? It's a lot of variables that play into it. And you'll see that across high school, college, and professional athletes. The strongest person in the weight room is probably not the best athlete on the field.
No, typically not. They can't move that well if they're that strong. But Connor, you got anything to add there?
No, you guys got it. That was all perfect. No, you guys said it perfectly.
Okay.
I love hearing his crystal clear voice.
Yes, it's very nice. And then who is good? Heels over toes guy.
This is news to me.
You've never heard of heels over toes? He basically shits on all the like fitness influencers for their claims that are somewhat outlandish and just puts them on blast a little bit.
I should get on his podcast.
I don't know if he has a podcast. I don't even know if he's like a who he is as a person. It's just, yeah, look him up. There's some, it's a lot of weightlifting-esque stuff too, or Olympic lifting. But he's got some good stuff. You looking it up, Connor? Yeah. There's so follow heels over toes guy instead of knees over toes guy. Well, you can follow them both. I don't care. Anyone else in the fitness realm? Any final calls of what people should look out for when it comes to social media? Because I see it mess people up more than it helps them.
If it seems like it's overcomplicated and there's a guru attachment to it, you should probably stay away from that person. The person that you're looking for is someone that's probably working with athletes and you can see them working with them. And it's the simple stuff. It's nothing overcomplicated, like Connor was saying. The simple stuff just does not sell. So you might not see these people on Instagram. You might see them more locally. So it's mostly just networking with people that you know and trust in the health and medical field to be like, hey, who's good around me? The people remotely can be good, but you're never going to get as good care as if someone's in front of you.
Yeah. And I feel like there's a movement now with like newer PTs too, to just, they see all these exercises and they just want to throw sexy, fancy exercises at people for the sake of it being like a hard, sexy new exercise this person's never done. It's like, now that I've been doing this for as long as I have, I'm like, I'm sticking to the simple meat and potatoes. Like, this is what people have to do. This is what they have access to.
Just not clamshells.
Just no. Fuck no. I think I've prescribed clamshells maybe twice in my 7-year career as a PT here.
Caveat: love a good super clamshell.
Super clams, but that's
better
different.
Exercise.
Yeah, but
not inappropriate.
That's like
side root clams. You can freshen up a clamshell so easy.
That's like comparing like Gordon's vodka to Grey Goose or something. Like 2 different levels. They're not even on the same page.
It's like Poland Springs vodka.
Yeah.
Which is a brand. Look it up. It's not good. Oh, I had to keep it here.
Just hold it there. Don't be waving it back and forth.
I was doing the one couple words at a time.
Yeah. So yeah, I think the big thing is just watch what you're watching as far as like, if they speak in these absolutes of always, never, you need to do it this way, you need to do it that way, or this is going to be life-changing, be careful with that stuff. And it's really, there is so much nuance to the movement and the body and injuries and pain and rehab that like, you got to take the shit seriously. Go find the help of someone that like understands you and knows you versus just trying to figure it out with YouTube. Because a lot of the times, yes, those people can be putting out very good educational content, but too many times, like in my own experience, is people are naively disregarding some of the rules set about when to use this thing and why. And that's the biggest problem. It's not the person creating the content necessarily, it's how the person consumes and tries to apply the content that's usually lost in communication along the way.
I'll say this as well. When I'm specifically working with low back patients or chronic pain patients, the end goal for me is to make sure they're educated on what makes them better and what can help them so that they don't have to rely on me or any of us, for example. Because at the end of the day, some of these issues are going to pop back up and I'm not going to be around. Like, I'm leaving in 4 days. So
you made it sound like you're dying.
Some people have made it feel that way when I'm leaving. Like, oh no, you're leaving. I'm like, yeah, sorry. It's like the death of Tom. I got to rip off Tom and replace it with Thomas again. My full name. But like, I want my patients to come out with an education that is well-rounded, that they can essentially self-manage their symptoms if they come back. That's what a good clinician should do for you. You're not just shelling out money to have someone put their hands on you and massage you and give you all the things and lead you down this path where they tell you nothing after that. You want to work with someone that gives you the tools to succeed and shows you how to use the tools. It's like Connor with power tools for the first time, and Connor with power tools now, but you got to actually teach someone how to do these things. You can't just be like, Connor's bad at power tools, which we can kind of say at this point, but we also want to say
he did make a straight line with the saw.
Let's teach Connor how to use power tools better, right? So I'm sure if Connor worked in carpentry for a year, he'd be really good at carpentry. He has not worked in carpentry for a year, so he is not good at carpentry.
I don't know if he'd make it a year in carpentry. He cuts the wood too slow.
Still the straightest line and
It was a straight
east
line.
of the Mississippi.
I'll give you that.
Hell yeah, brother.
So I think the other topic we want to talk about is, that's one of our frustration points is people come in and they're always like, oh, I tried this. And you're just like, oh God, let me face palm myself here and de-educate you and re-educate you on like why this isn't the best approach for you and what we need to do instead. And then just navigating the healthcare system with patients is really hard. And our frustrations with doctors, with the healthcare system, there's so much to be said there about the health of this country, where it's going with like the political side of it. There's too much I don't want to even get into, but what are some of your biggest frustrations you have with doctors?
I almost want to reroute the question and ask both of you, how many of your clients do you feel like you are their primary care or their entryway into their medical knowledge and know-how?
I would say I feel like half of my job now is being someone's advocate and guiding them through the healthcare system, because nobody has time these days to look at anything outside of checking the boxes for the insurance company so that they can bill them and make money back. And if you're not dying on the table or nothing seems super wrong, then they brush you off. And so it's constantly us finding ways to find alternative approaches, better assessments, evaluations to get these people the help they need.
I will say we have an exceptional situation too, where we get to spend an hour one-on-one with our clients. And a couple of my clients have even joked, like, you know more about my general health and well-being than any of my doctors. And I take a lot of pride in that, and I know both of you do as well. But I feel almost like a medical manager at some point, where I'm asking, when is your rheumatology appointment? When is your neurology follow-up? Hey, what came back about the MRI? Like, it's very multifaceted when you feel like you're almost their medical manager to a degree.
Yeah, this kind of is going to be me shooting bullets at primary care physicians too. But like, when did I become a primary care physician? I don't know when I did that or how I did that, but you shouldn't just be referring your patients out to random people and not giving them a solution or not helping them identify like, hey, what's going on? I feel like most of the time I'm dealing with patients from a musculoskeletal position for chronic or acute conditions where their primary care has given them nothing. They've referred out to PT and said, hey, figure it out, rather than help manage the case.
There's good and bad to that, though. I think, and I don't want to blame the physicians themselves, because it's really not so much just the PCPs or your general care physician. It's the model they're in. Like, they literally, based on the business model we have set up, they have like 7 to 15 minutes with you. Typically, I think the average is actually 7. So how do they get in, make sure you're not dying, basically? Okay, you don't have cancer, you don't have cardiac disease, you don't have metabolic disease. You're good until next year, right? That's not really healthcare, that's sick care, but that's the model we've been practicing in. And yes, it needs to change. And it is good that they just say, when we do have physicians that say, oh, evaluate and treat, I would rather someone come to me from a physician where the physician said, I don't know what's going on with you, but it's musculoskeletal in nature, versus when someone comes in and the doctor says, you have arthritis, this is going to be this way for the rest of your life, and you just have to stop doing all the things you're doing. Like, I had that patient a few weeks ago, 50 years old. She had whacked her elbow on a door and like it inflamed the tendon. She had like acute tendonitis. But the doctor told her that women over 50 probably just shouldn't ever lift weights, and that she should stop lifting altogether. This injury wasn't even caused by lifting. And it just like, what the fuck? Like, you literally, like, why would you tell someone at the age of 50 that's a female to stop lifting? Like, we're fighting bone disease, we're fighting osteoporosis, we're fighting metabolic disease, we're going to help with cardiovascular disease by lifting weights, we're keeping our functional activity higher. Why are we telling people to stop lifting when it's not even the way they got hurt in the first place? And I think, yeah, physicians need to cover their ass and say this and that so they don't get in trouble. I'm telling someone to do it, but we really need to take that with a grain of salt too.
Yeah, I partially agree, but I think it goes back to the statement, like we're seeing a lot of this, and it might just be the model that we're in, where it's like, yeah, my PCP said this, and we're like, why? Why did they say that to you? That's very nocebic for one, which means like it's fearful of pain or fearful of injury, and that makes our job harder as musculoskeletal providers. But I also feel like in the realm of like case management, there have been some cases that I had been like, you need to talk to your your PCP about this and get this referral because you're not getting any help on the medical side. I can't do everything on the musculoskeletal side for you. That's already been like cut and dry. We know what's going on there. There are other things medically that I cannot help you with. You need to go here. In that realm, like it's our job as physical therapists to make that referral and say like, hey, go back and talk to them about this. But at the same time, like this is getting missed, and it might just be the systemic issues involved with insurance and the time that the PCPs have and the education model, which has been a whole different discussion. But again, it comes back to my main question of like, when did I become that primary care? Like if PCs are going to do that in the military, maybe that's the route we need to go because they're starting to utilize PTs in that way. But,
which is awesome. I think
yeah.
I think it's really cool that we are getting into this, and I think it's really cool that we as a business are actually like, not that we're acting out of scope or anything. Let me put that disclaimer out there, but we are doing a lot to help manage people's like chronic health conditions and comorbidities and things they have going on, and we've become like the triage for people to be like, yeah, I don't think you need to go see the ortho. You need neuro, or you need rheumatology, or you need a psych eval, or whatever. We won't maybe tell someone they need a psych eval out. But like sometimes there's like a psychological component that people have no idea about, their doctor hasn't told them about, and they have no idea like that their anxiety and depression is like a major contributor to their pain.
Mm-hmm. Yeah, and I think I would love to see that model transcend into the civilian side, but I think this the change has to happen at the schooling level for PTs to then be successful at that. Because right now we're not even successful coming out of school for a lot of PTs. There's a lot of new grads that are head above the water, drowning.
I know I taught you guys.
Okay, Brad. But yeah, that model would be great if it was then like, hey, let's reinforce this at the university level, which probably won't happen in my lifetime, but I think the big takeaway is like, yeah, we get more time with you for one, and you have direct access to us, at least in the state of Massachusetts and New Hampshire. So that's one of those caveats where it's like, maybe you don't need to see your primary care provider for your musculoskeletal pains, and we can essentially screen you out for these larger things that we'll obviously refer out for, like a neurological condition or a cardiovascular condition. But it seems like a lot of that healthcare space has been offloaded into PTs in the past 5 to 10 years because of how insurance has changed.
It's getting there. So as the direct access, my issue though still is more that people still want to go to their primary care before coming to PT. And it's like, please, no, just come here first. Like, we'll save you the headache of going there and getting no answers. And half the time, yeah, they get fear-mongered into thinking all this stuff is wrong. Like, one of our patients, clients, whatever, came in before, and she was like, I got diagnosed years ago with lordosis. And I was like, cool. That is just the normal curvature of the spine that everyone has. Maybe yours is a little excessive, but no, there's like no
Not a
finite
death sentence, though.
It's not a death sentence, and there's no like finite description of what a normal lumbar spine should be to be fully functional. And it's just, and then people are like, oh, well, they told me don't do PT or don't do this, or like, this is just, the worst is the death sentence statement of this is just, you're going to have to learn to deal with this for the rest of your life, when 95% of the time that's not the case, if not more than that.
My favorite too is when they say, my doctor said I can't squat anymore. And I was like, well, do you use the toilet? Because you do a squat every time you sit down.
And the other thing too with that is not only are these doctors saying, don't do this, don't do that, they haven't even taken any bit of a look into how you do any of that. Like, we're just blindly saying, stop doing these things. It's like, well, did anyone watch you do it? Like, maybe you're just not doing it the best, or there's a better way for you to do it. Same with like even orthopedic surgeons and stuff are like, well, that hurts, stop doing it. It's like, well, did you even see a video of them doing it or what it is? Like, I'll speak of this. So the girl I've coached in the past that's a weightlifter and a power lifter, she went to her ortho because she got hurt and she was describing weightlifting and he kept talking about powerlifting. She's like, no, this is a different sport. He's like, there's no way you could have done this doing this. And she's like, no, like this is what it is. And she's like, you need to go look this up. And it wasn't until she came back for like her third visit. He's like, oh, I looked up what you were talking about. He's like, that makes sense. But he argued with her for 10 minutes about that she couldn't have gotten hurt this way and just didn't understand it and was giving her advice without an understanding. And like, luckily he came back and admitted it, but it still stands that people are giving advice without really knowing the full picture, especially in healthcare right now. Most people don't like, that's what's great about being in the place we are is like, we have time to dissect these things with people. A lot of people don't have the time in healthcare to fully get grasp on what's going on with you functionally.
I will give a shout out to some of the military physicians that I saw when I was doing my medical screening. Was probably the best physical I've ever had because they watched me move.
Really?
They literally had me do the duck walk, which everyone talks about with your hands on your head and you're kind of squatting, walking all the way down the floor. They had me squat. They saw my range of motion in my hips and my knees. They tested my strength, my reflexes. Nowhere in my 26 years on earth has that happened in a physician's office in the civilian side.
Well, even, yeah, that reminds me of, and we're just talking about my mutual patient that I share lots of commonalities with too. But when I was getting diagnosed with the ankylosing spondylitis, which is literally, for those of you that don't know, it's supposed to be fusion of your spine, shoulders, and hips, which is a major movement disorder and like can cause someone that's not medicated a fair amount of disability. They had me try to bend down and touch my toes and side bend side to side. They didn't look at anything else. They didn't palpate my spine. They didn't touch it. They didn't have me rotate. They didn't have me try to lift anything. It was just, and they didn't even take x-rays actually. So it's just like, man, how, and they told me to never lift weight more than my body weight ever again.
Just to be clear, he is very strong.
Oh, thank you, Connor. I lift quite a bit more than my body weight now. Ever since then, I was like, fuck that. I was like, I'm not listening to this. They told me to stretch and do yoga for the rest of my life. Where it's like, well, even if I hit disability as I'm older, I'd rather be strong when I hit that realm than weak.
I wonder in what alternative universe Yoga Brett would be in now if his disease advanced because of those recommendations.
Yeah, it's interesting because I think for me, like weightlifting is a blessing and a curse of like, I still like, it's a sport that demands a lot of mobility, but being motivated enough to do the sport has forced me to focus on my mobility and keep it. And for a disease that is supposed to make you like flexed and hunch over, and I, someday hope I never look like the Hunchback of Notre Dame, but to my knowledge, the last x-ray I had, he's like, you don't see, like, we're not seeing any degeneration of your spine whatsoever, which is great. So
You're telling me load is healthy for the spine?
No. Really?
Yep, believe it or not.
That's sarcasm, by the way. I don't know if I caught.
Yeah, if you're not watching. So yeah, it's just a matter of like, this is something that didn't make sense to me. I was like, I feel better when I'm lifting weights, so I'm going to keep doing that. And look at me now.
Yeah, that's like a prime example of like, that didn't make sense. I'm not going to follow that. I'm going to go my own route, which makes sense. I need to load my body to maintain tissue. It's not like you had an issue with loading. You've had times where you've had pain.
Yeah.
You have been limited, but you've decreased your load and you've brought yourself back. It's a simple reduction of volume or load or intensity, and then scaling it back up.
Yeah. Back to what we said in the very beginning.
Correct. It's like the simple things, right?
Yeah. And yeah, there's some more complex things of like, I should probably do some more like thoracic rotation extension type stuff, but there's a lot going on in life all the time. Just can't find time to stretch. Go ahead, Connor. What do you got?
Oh no, I was just saying, I think everybody could use a little more thoracic rotation and extension. You're good there.
Thanks, bud. And so, are there any other crazy stories of working with people that like we've just found that things aren't ideal?
For me lately, it's been the lack of knowledge provided by medical providers, whatever type of a clinician you are, on how the mental health game can affect your orthopedic pain. I feel like I've been dealing with a lot of clients lately and almost educating them on the fact that, like, hey, if you're having a bad day emotionally, like, more than likely your Achilles pain is going to be worse that day. And like, yeah, maybe your back pain is a little worse that day, but it's a matter of, can you pull yourself out of it? Stick with your homework. Are you sleeping enough? Are you eating enough? Are you doing whatever you need to for your mental health?
Yeah, I mean, I think the big thing here that no one really talks about, and it's a tough subject for us to bring up with people too, but like anxiety and depression are big things that are huge contributors to pain, and no one wants to talk about it. And I think that the general theme of that is that people need to just be made aware that, you know, again, no one, like, it's a tough topic for us to even talk about, but if you're dealing with anxiety, depression, you need to tell your physical therapist or whoever, like if you're dealing with pain, that can be a major contributor because what can happen here is the brain's just kind of high strung looking for something. It's always looking, and especially if we're in like a depressive state, our brain automatically goes to the negative. So it's like, well, I feel better today, but I'll probably feel worse tomorrow. Or tomorrow's probably not going to be as good as today. Or, you know, we could do all these things and wow them with treatment and improve their mobility. And like, they'll lean and be like, yeah, but it still hurts. It's like, well, does it hurt less? It's like, well, yeah. It's like, okay, well, that's a win. Yeah, okay. And so it just becomes this place where there's so much that happens in the brain too that like people don't know about. Right. So like I was educating someone the other day actually about like, they came in with all these feelings and thoughts and I was like, well, yeah, I was like, and they had like a rough couple weeks and their pain had been slightly worse. And there was certain other factors there too. It was like they hadn't been moving as much and this and that. But I was like, yeah, you know, for all of you out there, like there's no pain center in the brain really. The one thing they find when they like stimulate someone to put them in pain or provoke them is the emotional center of the brain. And so if the emotional center is in distress, well, then we are probably, if we're already experiencing pain, that area is correlated to our pain. It's going to light up and create more of what we're already experiencing. And it doesn't mean anything's actually physically being damaged. It just means that we are in a place where our brain is a little more sensitive. The alarm sensor has been triggered a little bit easier. And we need to just kind of understand that and respect it for what it is more than try to necessarily change it in that moment.
Yeah, I'm going to kind of piggyback off of the alarm system a little bit more. I think Urson Religioso, who is a mentor of ours and a great clinical instructor and clinician, he was telling the same kind of metaphor of the alarm system. It's almost like you have someone break into your house, a burglar, for example, and they steal some things. No one's harmed, but some things in the house are ruined or stolen. And a normal response would be the police show up, they do an investigation, they look for the burglar, they might get the burglar. The house is put back in order. You maybe get like a security camera, all is well. It doesn't happen again. The alternative side of that is, okay, now things are hypervigilant, right? Something bad just happened to us. And now we're like really fearful it's going to happen again. So we put up a barbed wire, we have a gun in the house, there's a guard dog, the locks are all triple locked. I have this inside room in my house. It's sheeted with metal and I'm in there. I'm watching all the cameras on my,
It's very elaborate.
my house. This is how I kind of describe it because I kind of make it over the top for the patient. And I say, and the police are all around the house. And then one day you fall asleep at your desk on the cameras, kind of like Jigsaw, always watching all the cameras. And the alarms all trip, everything goes off, the windows slam shut with the metal barriers on the outside, and there's gunshots outside the house, and everything quiets down. You look out in the cameras, and there's a dead squirrel in the front yard. It wasn't a burglar. It was just a squirrel. And
Why'd the squirrel have to die?
someone's got to die in this situation, and it's got to be the squirrel. So I tell them that because, like, okay, the squirrel's innocuous. The squirrel's just doing his business, and he got murked because like you're essentially over vigilant, and everyone was like fearful of a burglar again, right? So you had all these systems in place to prevent this thing from happening, and something innocuous happened, and everything blew up. So when someone's really sensitive, I say that to them, like, this is your whole nervous system right now. It's like super protective of this area. Why is it protective? Because you had something happen and you had an overreactive response to it. We have to then break down those barriers. Like, okay, the police can leave. We don't need them. We don't need the gun in the house. Maybe we can change some of the locks and that'll fix our issue. Like, back it down to a more reasonable level. Because, yeah, a threat or insult happened to the tissue. We should be aware of that. We should recognize that. But don't take it to the extreme where you're going to kill the squirrel.
I would say I dumb that story down a little bit. And it's actually, this story comes from Ramez Antun, our other mentor. That's not an Urson. Yeah, sorry. But
they're very similar while being different.
Yeah, very similar while being different. But I just say it's like, yeah, your house got robbed, so you put the security cameras in and you turn, because someone just broke in, yeah, you're hyper vigilant. You turn the sensitivity on it all the way up. So now you're out and about, you keep getting this notification. You're like, oh my God, someone's robbing the house. And you look and it's like, oh, no, it's just a squirrel. I don't go into how the squirrel got murked and all this, but I mean, you can do it however you want. It's still the same. Moral of the story is the same.
At the end of the day, I want you to smile and realize, like, oh yeah, I am kind of hyper vigilant about this area.
Yeah, I mean, rightfully so. We have plenty of reason to be. It's just how do we turn that system down sometimes instead of ramp it back up? And I think, yeah, the whole depression thing of like, you can just be in this downward spiral too of like not taking good care of yourself. You don't have the time or the energy you feel like, and you're just fatigued from everything because you just in general don't feel good. You know, what contributing factors are there in that, and how do we help you with that? And a lot of times, like, we end up doing a lot for people in that realm of working with them through all kinds of lifestyle, behavioral issues. Like our client with the pink hair, right? When she came in, her life was in shambles a bit of like, she wasn't sleeping, she wasn't eating, she was working out way too much, addicted to stress. And instead of doing like traditional PT, we literally went through like basic behavior change of, okay, let's dial back your cardio first. Okay, let's try to focus on creating like some type of routine around falling asleep. Let's create some type of morning routine about getting ready for the day. And then like she's been doing a lot better in that realm with things because, yeah, we didn't just try to throw exercises at her. It was like, this is a major lifestyle thing that like took precedence over everything else. So I think those are the important things to realize too with going to physical therapy or seeing any type of doctor is like, there can be a lot of simple things you can do that you can get out of someone and you should be able to talk to them about. Fact of the matter is no one has time and it just sucks. So when you find those providers that do have the time, it's like, you know, that's why I started as like a cash practice too, is it's just like, I noticed the difference of being a trainer versus a PT in a regular clinic. I just had more time with people. And so the fact that we can do that now in the realm where we have the time with the people and we can teach them all the things they need to do, and we have physical therapy and coaching experience behind us, there's not much better we can do. Connor, what do you got?
What is the best case scenario in terms of both of you thinking in terms of the medical model, in terms of educational systems that can kind of change for the better? Where do you see it going for PT schools?
Well, I'll say, I mean, there's a lot that we could have a whole nother podcast.
I was going to say that's a very loaded question.
That's a loaded question. I'll say
top 3 bullet points are things that we can improve on both as a profession and in terms of getting new clinicians ready to best serve clients.
As physical therapists or as like medical practitioners in general? Both? Okay. So, I mean, if you just listen to that, did you guys listen to that Casey and Callie Means podcast?
Yes.
it was wild, right? Like to like have all that shit put together.
They were very, very passionate, almost talking too fast. And I listened at like 1.5 times speed because I need to listen fast.
Yeah.
And I was like, I got to slow this down because they were moving.
Yeah.
But yeah, there's a lot of things like that are systemic issues across different fields, across different major corporations. So I think from like an individual standpoint, that's harder to address, like the changes I would want to make in the PT realm. But I'll say, like my top 3 bullets points coming out of school in the past year, like just spend some more time not thinking about like the range of motion that matters or like how strong someone is, and take an overarching view at the subjective. Most of your information is going to come from the person sitting right in front of you.
Yeah.
And it's going to point you exactly where you need to be for your diagnosis or your clinical diagnosis, and then where you need to go from there. The next most important part is not any of the tests you do, which the OCS exam, which I'm currently studying for, will harp on. Like, you need to do this test with this specificity, this sensitivity for this diagnosis, because this is what we do. And it's like, okay, yeah, sure. That's one small tick on everything else that I'm going to do in that objective. I don't really care about that until I get right to the end of the whole objective. What's more important is having that framework from your subjective to then selectively choose those objective tests and measures. And also a global understanding of how someone moves. Like, they could have a positive on a very specific test with crap specificity and crap sensitivity. That's the gold standard test for the whatever muscle or whatever joint or whatever ligament you're testing. That doesn't tell the whole picture. So focusing less on those individual tests and more on those movement screens in general should be another thing. Thirdly, how you educate a patient. We don't get enough, essentially, in school on the education piece as we're being educated. It's like this weird duality of like, okay, we're teaching you how to do things, but we're not teaching you how to teach. So I think one of the strengths I had coming out of school is that I was a teaching assistant for 2 years. And I had that experience with 4 different classes of like, how do I actually convey this information in a simplified manner to students who don't know anything about this, that I can then elevate that and teach them more the next day.
Yeah.
Stories about how you kill a squirrel.
Yeah.
I can't hear you without a mic.
Stories about how you kill a squirrel.
Gotta murk that squirrel.
I'll say mine are, this is a good question, Connor. So I would say that the big thing, is that education piece of, hold on, excuse me. Jax, come here. Down. Or go away, sorry.
Bye, Jax.
He's getting antsy. So anyways, I think the biggest thing is that education piece needs to shift from, in PT school and in medical school, I think now too, what we're being taught isn't making us good clinicians or providers. It's making us legally defensible, and that if something goes wrong, we know how to document to cover our ass.
Correct. The whole license exam is that. PT, literally all we go to school for is to take this licensing exam. For the 3 years you're in PT school, all they talk about is you got to pass the boards. Well, this matters because it's going to be on the boards. And that's what your whole academic career is centered around, is making sure that you don't get sued versus focusing on how do we get this person better? What things can we do to make someone's life that much more of value to them or of high quality? And we're not focusing on getting better treatment outcomes based on that. We're worried about testing for treatment outcomes, but there's a lot more we could do if we were given the skills of how to interview someone better, how to coach someone, how to do behavior change, understanding nutrition, and like basic behavioral science of like living a healthy lifestyle 101, which we never had a course on that. And whether it be for physical therapists or medical providers that are primary cares or whatever, that's another issue like that podcast brought up is that's like, I think it was 70% of Harvard, Stanford, or Yale's medical school was funded by Big Pharma. And so most GPs have like 3 hours of nutrition training versus all this stuff they're fed about pharmaceutical companies. It's like, it's not really the right place we need to be going with it. If we really want to make a difference in how people are going to get better, because we're just like fueling a sick
care filled.
It all comes back to the money. Just follow the money. That's
Yeah.
where it goes.
Reeling it back into the positive. What were your 3 points again?
So that was my first one about changing the education of we're focused on that. We're focused too much on defending ourselves versus providing good care. That's my main one. The other thing I think that needs to change is, the incentive strategy has been all based on this model of we need to be focused on billing and how much we can bill. And that's like what the incentive structure is for most people. It's not about actually getting them better or getting them off medication. It's about, well, how many visits did you just see today? And, how does that affect our business and the bottom line versus, well, we have a huge epidemic of many proportions. So how do we fix that? So I think the focus on that. And I think the other thing is, we're seeing it more and more now of like functional medicine, alternative medicine, all this stuff is really becoming like the new trend of like, if you want to be fit and healthy and live like a good quality life, like we need to leave the insurance model because they don't care about us in the sense of like, they might keep things at bay for a while until it's like, oh, well, you go in and you have this thing. It's like, well, let's put you on this medication, right? Even like, my friend went a while ago and he's like 30 and his cholesterol was a little bit high. Like, we're going to put you on a statin. And he was like, well, what could I do from a nutritional standpoint? Like, oh, you want like nutrition advice? He's like, well, yeah, like, why would I want to go on a statin? Like, well, we didn't think you'd want that. Like, we just assume everyone wants to go on the pill. And it's like, whoa, like this is a huge problem. So, but I think going into this, like paying out of pocket for healthcare, if that's what it takes to be healthy, I think people need to do it. And I think more and more of these clinics are popping up where we're getting better results than others. It's becoming this turning point of, okay, like, you have to pay if you want to stay healthy, but like, to me, it's always been worth it to pay out of pocket to figure shit out with all the stuff I've had going on with me in the past few years. So it's like, let's sort that out. And like, I'm good paying you as much as I need to not suffer now or in the future. So I think those are the 3 things of like changing the way schooling works, where the funding is coming from, and why we're forced to learn these certain things, but not the things that actually make us good at what we should do. And then, changing the piece there with the students. I'm done. You got it.
No, those are all really good points. I appreciate both of your input. I think the only thing I would change too is give specifically PTs more of a background on exercise selection and make them feel more like strength coaches in a way, because I feel like I know a lot of kids in my graduating class who would struggle to prescribe exercise as a therapy.
Yeah, I mean, I'm literally teaching courses now all over the place on how to like integrate exercise into physical therapy, because we literally, and like, so like physicians get 3 hours of nutrition, physical therapists, for some reason, I got 1 3-hour exercise lab that I ended up teaching to the class. True story.
That's really upsetting. I would say too, like there's a good course now at UMass Lowell where they do essentially a debate, and they do it at other universities as well.
I want to go in there and fight someone.
I mean, you could throw hands, but there's some good debates in there. Like, are PTs the movement expert? That's like a good question of like, are we? What are you taught about movement?
Yeah.
Do you understand everything about biomechanics? Do you understand anything about movement screens? Do you understand anything about athletic performance? Or do you know how to measure knee flexion?
Mm-hmm. Yeah.
Right. So I think as I've been out of school and out of that realm, it's like, probably not the movement expert, but well trained in it, proficient for sure.
We're better than chiropractors.
Yeah.
Just throwing you on spot here.
Yeah. Some chiropractors are good, like we talked about, but there's bad apples in every field. Find the people that work best for you. But at the end of the day, like, I think those are the bigger questions of like, what are we as physical therapists? What do we do? What is our role? That goes back to like, do we manage those primary care musculoskeletal issues? Yeah, we do. Are we kind of a referral network in the cash-based world? Yeah, we kind of are. So I think you're going to start to see more and more of this. going away from insurance as it starts to make less and less sense, as the insurance companies tend to make more and more money based on the models that we're seeing and how kind of fed up people are. It's kind of like across the realm of a lot of different things. A lot of people are fed up with a lot of different systems that have been in play for kind of decades now. And I think we're kind of at the crux of a turning point with a lot of these bigger issues.
100%.
I will say too, I know a lot of the clients that are more and more willing to pay cash for different services are also medical providers. I know like people that we refer to other cash-based, because the other thing too to keep in mind is we refer out to other clinics all the time. Like if there's a person that's not the right fit for us, more than happy to send you to a different specialist. And it just so happens that I feel like a lot of the people that are more open to the cash pay idea are also medical providers because they know how bad the insurance-based network is.
Yeah, there's too many things you have to do. There's too many constraints, not enough time. You can't do what you want because you have to spend half of your time actually just documenting instead of helping the person. So it's just, yeah, it's a model that's failing and it's not doing well. And it's, I mean, our clinic literally thrives off of people frustrated by traditional PT, hands down. So
I think a question across healthcare that also kind of rings true to me is like, when did insurance companies start practicing healthcare?
Yeah.
Because to my knowledge, there's no license in a lot of these big corporate insurance agencies that have any license in medical or most adjacent allied health.
My understanding is typically it's nurses that sign off on our notes.
Yeah, the nurses that I've worked with, love them to death. They're great at their jobs. They're not good at movement screens, and they are not movement experts.
No. And like, how can a nurse justify what a physical therapist is doing for their care?
Yeah, I didn't know the nurse's license covered my license. That's crazy.
Yeah. So,
because my license definitely doesn't cover a nurse's license.
No.
I'm definitely not capable of doing their job.
Yeah, like that would be like me saying like, oh, you want to inject this person with this? Cool. I don't know. Like, oh, the person died. Shit. Sorry.
Oh, maybe I shouldn't have ambulated them. Oh, they weren't ready for ambulation.
Yeah.
Oh, I didn't use a gait belt. Oops, they fell and fractured their hip.
Mm-hmm.
Yeah. That's my main gripe. It's like you're receiving care from a model that doesn't care about you, that wants to abuse your dollars, that gets a basic amount of money from you each year, that then has you pay more money before they cover you to then provide you subpar care that doesn't actually fix you, but just makes you sick. And Connor's going to hit us with some positivity. I can feel it. He wants to vibe.
No, I was just going to say, let's put a bow on this with a little more positivity.
There we go.
I want either one action item from both of you that you would start implementing tomorrow if you were somebody that is looking to improve their general health, or something from physical therapy aspect. Ooh, Tom wants the mic back.
Get some friggin' sleep. Like, stop staring at your phone. Have some quiet time. You should have a schedule. Set it in your phone. Like, here's a reminder. I turn my phone off, put it on the charger. Have your quiet time. Dim the lights. Get sleepy. Fall asleep. 7 to 9 hours. It's going to be life-changing. Most of the time, people aren't getting that, and they're not doing it quality. So their sleep quality is poor. They're not sleeping long enough, and they're waking up and not recovering. A lot of the issues that we see typically resolve partially with improving someone's sleep.
Mm-hmm. My tip of advice after that, like that podcast I listened to. So if you're interested in some of the stuff we're finishing up with here, Casey and Callie Means. So she was in her last year of residency school to be a surgical ENT, and quit because she just realized like people aren't getting better, and surgery and pills is just actually making us sicker and not really getting to the root cause. So I heard her on Tucker Carlson, and I know he's a figure with some people have different opinions on him, and that's fine. But it was a very interesting podcast with her and her brother, who's a politician, going through everything there is to know about how big pharma is sleeping with the government and how insurance companies actually work, and how, yeah, the incentive strategies for doctors work and for healthcare in general, and all the shit like the plastics, and the processed foods, and kids being on the pill, or on 6-year-olds being on weight loss drugs. Like, they went through all this stuff. So it really just, if you listen to that, it'll bring you a sense of like how unhealthy we are as a population, but really just focusing on the basics of like, don't eat processed foods, exercise every day, and yeah, get a good night's sleep.
Boom. Not groundbreaking, not sexy, simple but effective.
Simple doesn't sell though.
Simple
Just do the
sell.
simple things and you'll probably be better off in general. Obviously, through more specific things, see a medical provider you trust. But the very basics, you should have your foundation built before you build your house. Don't just build your house on some mud.
What's yours, Connor?
If you're a medical provider, I would say build a really strong network of people that you can refer out to, because I feel like things got really easy for me when I started realizing what I can handle and what I should refer out for. Like knowing what's wheelhouse and what you can hit a home run with, versus if something isn't working, it's time to look elsewhere, or at least get another set of eyes on it. Because I'm lucky where I have you guys and now Nick coming on board, other sets of eyes to look at things. So it's one of those things where it's like, if you notice that something's not working or something, you're slamming your head against a wall, I'm lucky I get to have a couple calls with Ramez every now and then, annoy him, and have a network if you're a clinician, for sure. If you are a general population, active adult, anything like that, I would not be afraid to leave whatever medical provider you have if they're not meeting your needs, because you can't just keep pushing off your health till next year's primary care visit. Like, you need to address things now and not let things build and get worse. I highly recommend the book Outlive by Dr. Peter Attia. It was fantastic. I recommended it to my entire family, and they'll all probably be getting copies for Christmas this year. He has a lot of chapters based on neurocognitive health, physical health, and he had one chapter that was really enlightening about his mental health as a physician, as a medical provider.
Yeah, I've started that one. I need to get through that. But yeah, Tom, any last words before you leave this company for the foreseeable future and go into your military career?
He said foreseeable future. He's thinking about the future. He wants to hire me again.
Yeah, we like you enough. I'd have you back.
No, I think like I chose to work with this company for a long time because I was a strength coach prior, because I wanted to learn and I wanted to be outside of the insurance model. I kind of had that experience when I was working exclusively with firefighters in Denver, which is an awesome experience. If you ever get a chance to go see a live burn with a bunch of firefighters, so fun, so cool. If you like watching things burn, great. Little pyromaniac stuff, stuff. I'm just kidding. But I think like working in something like this has prepared me well to then jump into the military, because it's a different world. It's eval heavy, but my evaluation skills have blossomed in the past year. I have improved where I'm going with my treatments and how I can utilize my skills effectively. Like dry needling, for example, I'm a dry needling specialist now, and I wouldn't have sought that out unless I thought I needed it for the military, but it's just a tool in my toolbox. The real thing that matters is how I got to use that tool. So if I choose to use, like essentially what I spent $3,000 learning how to do, I have a pathway to do that successfully, and it makes my treatment look better because I chose that treatment effectively, because I learned at this job. So I think the biggest thing that new grads, or anyone that is a new grad at any kind of medical or healthcare or even any kind of a field, should pay attention to is mentorship. It doesn't really matter how much you get paid in the first year. It doesn't really matter how hard you work in the first year. It should just be who you're working with and what you can gain from their network and who they associate with. I've been kind of opened up to a large network because of that, which teaches me more and more about other kind of treatment practices and how people operate in the space. So that's been my biggest takeaway. And it's like, where am I going to go from there? I'm going to go kill it in the military once they finally let me in for all these medical consults. But once I'm in, it's game over. We're gonna crush some stuff up there and get soldiers healthy. So yeah, it's been a fun ride, guys. And it's always sad to leave a job, but you always look back and say like, oh, this was awesome. Like I had fun doing this.
We've had a ton of fun together over the past year. So it's been awesome to have you part of the team. It's, you're at home here. We appreciate you going in and doing your service for us and serving and protecting this country. And, you'll be a missed part of this team for sure. Connor, positivity here.
Forever a diamond dog. We will miss Tom greatly, and getting his chalky milks on his break.
We'll leave you in the group chat.
I have to hit him with an auga, which was one of Connor's war cries.
Okay. All right, let's wrap this up.
Ladies and gentlemen, thank you for listening to the Barbell Therapy Podcast tonight. This is Connor,
Dr. Tom,
and Dr. Brett
signing off. Have a great night and drive home safe.
Diamond Dogs out.
"84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram or visit ARKITECTFitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.